Hi, my name is Demetrio, and along with my partner Brian, we will be talking about cirrhosis, its signs and symptoms, and treatments using evidence-based research. So, what is cirrhosis? Well, cirrhosis is the replacement of normal hepatic tissue with fibrotic tissue. In layman's terms, it is the scarring of the liver. Another way to remember it is to call it scarrosis. There are many causes of cirrhosis, but the main ones are chronic hepatitis and long-term use of alcohol. And while the liver organ can heal itself from damage, continuous drinking and extensive scarring will affect its regenerative abilities. That is why cirrhosis is a chronic condition, and that extensive damage is permanent, that you might need to get a transplant. On the left, you can see a normal liver organ. And then on the right, you can see the liver with cirrhosis. I like to compare it to like a fried chicken. So the one on the left before you fry it, and the one on the right after you fry it. It's that bad. So cirrhosis. About 1 in 400 adults in the United States has cirrhosis. Most patients are between ages 40 to 60, so adults. And up to 50% of overall cirrhosis in the United States is alcohol related. Um, According to our book, women are more at risk for developing liver cirrhosis than men. And according to the CDC, cirrhosis ranked ninth in leading causes of death in the United States from 2018 to 2021. About 56,000, more than 56,000 people died from liver cirrhosis. Another interesting information is that 60% of all liver transplant cases are due to primary cause of cirrhosis, and that more than 90% of liver transplant cases have cirrhosis present. Here's that list from the CDC. Of course, you have cardiovascular diseases as the leading cause. Cancer comes in second. And then you have COVID-19 at the third place. And 6 more spots down, you will see liver cirrhosis just below diabetes. For signs and symptoms, you have jaundice or yellowing of the skin or sclera of the eyes, ascites or fluid buildup in the abdominal area. You have liver enlargement, hepatic encephalopathy or confusion. You have portal hypertension, enlargement of the spleen. You have spider angiomas, which is a common presentation in cirrhosis. It looks like a spider. Actually, sorry, the video got cut off. I had to move the picture because we couldn't see spider angiomas. So here it is, spider angiomas. It looks just like a spider web. It's on your skin, and it's common in cirrhosis patients. The next one is pruritus, and that's the itching of the skin. Here are some common nursing diagnoses. Risk for injury related to the hepatic encephalopathy. Chronic pain and discomfort related to the enlarged liver and ascites. Impaired skin integrity related to pruritus and jaundice. Ineffective breathing pattern related to the increased abdominal pressure, so that ascites pushing up on the organs. We also have some mental health stuff, some psychosocial, disturbed body image related to the altered skin appearance, like the spider angiomas or the jaundice. One thing that we really want to focus on is hepatic encephalopathy. This is when the mental status is altered. It is caused by ammonia. So normally the liver processes ammonia into urea, but because the liver is damaged in cirrhosis, ammonia builds up in the blood, causing encephalopathy. As nurses, what you want to do is to make sure that the client is safe. These patients are going to be fall risk, so make sure that the beds are at the lowest position. Make sure that the rooms are well lit up. And you can also delegate care by using sitters to watch for these patients. We also want to reorient the client to person, place, time, and situation, and that we watch closely for blood ammonia levels. According to ATI, the normal range is 15 to 45 micrograms per deciliter. Elevated means you're at risk for encephalopathy. According to Fabrelas et al., the use of oral or rectal lactulose or enemas is effective in preventing or treating hepatic encephalopathy because your poop comes with ammonia, or you get rid of your ammonia. Another way of treating encephalopathy is by watching what you eat. So in one study, they used a computer to generate this formula, that long formula that you see there. This is the equation for ammonia levels created by varying dietary protein intake and enzyme activity. As you can see there, NH3 is ammonia, that GLUL is an enzyme, and you see the urea, that's from protein. Anyway, what this whole thing, their whole study is basically saying is that an increase in dietary protein intake will result into an increase in blood ammonia levels. That chart that you see there, that is a positive linear relationship. So protein intake will increase blood ammonia levels. So for nursing intervention, what you want to do is to educate the client to limit protein intake. That means avoiding foods that are like animal-based. So eggs, you have your meats, your fried chickens, your porks, all of that. You got to eliminate it. Yeah.
Ascites is a complication of cirrhosis. According to Eichel et al., to relieve the symptoms of ascites, you should perform a large volume paracentesis, or an LVP. An LVP should remove about 5 liters of fluid. Nursing interventions include sodium and fluid restrictions, as well as having the patient void prior to the procedure. Variceal bleeds are another complication of cirrhosis. According to the Cleveland Clinic, more than 90% of patients with cirrhosis will develop esophageal varices, but only about 30% of them will bleed. According to Douglas, bleeding of the esophageal varices is a severe symptom that causes hemodynamic instability. Most patients with esophageal varices will not know that they have them until they are symptomatic, such as with vomiting blood or passing black tarry stools due to ingestion of the blood, and are therefore at a risk for aspiration. The role of the nurse should be to assess for bleeding and to utilize your ABCs, your airway, breathing, and circulation, to prioritize care and to manage bleeds. A Blakemore tube may sometimes be used to tamponade the bleeding. The nurse's role in these cases would be to ensure traction is stable and to assess for bleeds. If the tube becomes dislodged, quickly release the traction and deflate the balloon by cutting the tube. Some general nursing interventions by Fabrelas et al. Are to eat a healthy diet which is high in protein, low in fat, low to moderate sodium, and has increased fiber content. Increasing mobility also plays a role, since increased physical activity can prevent sarcopenia and has positive effects on the evolution of cirrhosis. You should educate patients on cirrhosis and its potential complications, such as ascites or variceal hemorrhage. You should schedule screenings for gastroesophageal varices as well as hepatocellular carcinoma. If possible, remove the cause of cirrhosis, such as alcohol or decreasing weight. A weight loss of greater than 10% is ideal in reducing hepatic steatosis, inflammation, and hepatic fibrosis. You should encourage clients to stay up to date on vaccinations, which include hepatitis A and B, COVID-19, the flu vaccine, tetanus, and pneumococcal pneumonia. You should also counsel on medication use, such as avoiding NSAIDs and aspirins. Paracetamol can increase liver toxicity in clients with active alcohol use, and use statins only in low doses. Comprehensive nursing care is a mode of nursing that focuses on the holistic treatment of clients. It emphasizes the patient-centered idea rather than disease-oriented, and assesses the patient's physical fitness, mental status, and disease severity to develop targeted interventions to improve prognosis and decrease the incidence of infection and complications. In a study by Go et al. In 2019, it was found that comprehensive or holistic care compared to conventional nursing care of patients with cirrhosis significantly reduced postoperative complications and had a greater patient satisfaction rate as well as higher quality of life and higher survival rates. And here are our sources.